Suppose you have experienced a conflict. After cooling down and slowing down to think about your goal or agenda and the relationship with the other person, you have decided that you would like to address the conflict because you feel strongly about your agenda and you value the relationship with the other person. So you decide that you will apply a cooperating style of talking through the conflict, applying cooperative instead of confrontational language, and reframe the dialogue as appropriate. You feel ready to take specific steps to move your agenda forward. What should you do? In this next segment, you will learn about basic negotiating principles that are used by mediators because they prove to help facilitate positive outcomes. They are particularly applicable to your relationships at work and especially useful in relationships with your superiors. In these 2 video clips, observe the communication styles and strategies of each professional.
Dr. Miller, this is Francisco. Mrs. Hart doesn't feel that she's able to handle the complicated IV regimen by herself. Is there any way that we can make it a little bit simpler for her?
Francisco, I'm in the middle of a medical exam. Can you talk to the discharge coordinator to arrange home health nursing care if Mrs. Hart can't manage it herself?
Okay, I'm so sorry to bother you. I will call her right now.
And next, I would like you to watch Pharmacist Anderson with Dr. Miller and his negotiating skills.
So he doesn't qualify, there's nothing we can do. I'm just a doctor here trying to get things moving as fast as I can.
I know, but if you give me a second, I have some ideas. If we replace the current regimen with ceftriaxone alone, but for a 4-week course, that would work.
A longer course of ceftriaxone would work, yeah. Okay, send him home with ceftriaxone.
Keeping in mind these 2 interactions, we will now learn the key components needed to negotiate to an agreement. Negotiating an agreement means that you are seeking a certain outcome while trying to preserve a positive relationship with the other person. According to the well-known book titled Getting to Yes, Negotiating Agreement Without Giving In, authors Roger Fisher and William Ury at the Harvard Negotiating Project list 5 steps to a successful negotiation. Note that these 5 steps reinforce your earlier learning, both in Module 3 on communication strategies and an earlier segment on effective communication skills for engaging in conflict. The 5 steps are to regulate your emotions, separate the people from the problem, focus on interests instead of positions, generate options, and use objective criteria. The first step in any negotiation is to regulate your emotions. As described in the 3-step framework, cool down is a prerequisite to collaborating or negotiating through a conflict. After regulating your emotions, you will be able to slow down or stop to think about what's really going on. In Scene 2, Nurse Martinez was unable to handle Dr. Miller's impatient and harsh manner, so he didn't persist in negotiating a good outcome. The second step in negotiation is to separate the person from the problem. In doing so, you will gain clarity as to what the problem really is, and the problem may or may not involve the person. Separating the person from the problem prepares you to begin to engage constructively, step 3 of the 3-step framework. Although Nurse Martinez had difficulty with depersonalizing Dr. Miller's criticism in Scene 2, in Scene 3, Pharmacist Anderson was able to do so and thereby continuing in the negotiation process. An important negotiation strategy is to think beyond your immediate position and to figure out what your goal and interest is instead. And do the same with your opposing person. Explaining your interests instead of focusing on your position is an effective means of engaging in collaborative problem solving through conflicts. In Scene 3, Pharmacist Anderson responds to Dr. Miller's complaint of, "I'm just a doctor here trying to get things moving as fast as I can," by acknowledging her interests with, "I know," and "What would you say if we..." Generating options is further expansion of the collaborative and creative problem solving that occurs in productive negotiation through conflict. Generating options with an open mind and an open heart. Pharmacist Anderson was able to facilitate decision-making with his ability to offer options to Dr. Miller and to persist in a respectful manner until Dr. Miller said, "Good." The final step, getting to yes, is the specific step of principled negotiation. When parties in conflict cannot come to an agreement on a solution, it is often helpful to rely on principles, such as patient-centered care and patient safety, that will determine the outcome. In Scene 3, Pharmacist Anderson did not respond to Dr. Miller's inappropriate comment about Dr. Williams, but did respond to Dr. Miller's direction to explain to the patient the importance of prophylactic antibiotics prior to his next dental procedure by acknowledging the merits of that directive. The art of negotiation requires strong communication skills in both areas of listening and speaking. Standard techniques of good listening are to pay close attention to what is said, to ask the other party to spell out carefully and clearly of what they mean, and to request the ideas be repeated if there's any ambiguity or uncertainty. Make it your task while listening not to prepare a response, but to understand them or their situation as they see it. Listen for their perceptions, their needs, interests, and their constraints. When it's your turn, speak to be understood. Talk to the other side. It is easy to forget sometimes that a negotiation is not a debate, nor is it a trial. You're not trying to persuade some third party. The person you're trying to persuade is seated at the table with you. Speak about yourself and focus on your interests rather than your position. There's more proactive and forward-looking than placing blame or responsibility on the other person. Speak for a purpose. In other words, communicate in a manner that will help you achieve your goals. To summarize, there are 5 steps to basic negotiations. In order to effectively negotiate, one must use strong communication skills in negotiations, including active listening and speaking. As you have learned from the last 3 segments, effective interpersonal skills of emotional self-regulation, apologies, and communication skills using collaborative language, reframing, and principled negotiation all map to the 3-step conflict management framework of cool down, slow down, and engage constructively. For this segment's forum discussion, watch the interaction between Dr. Miller and Dr. Williams and see if you can identify the effective first steps towards a productive negotiation. What specific behavior or skill is demonstrated?
May I please speak with Dr. Williams, please? This is Dr. Miller.
This is Dr. Williams. How can I help you this morning?
Good morning, Dr. Williams. I'm calling about your patient, Mr. Hart. He has spoken very well about you, and I knew you would want to know that he has been hospitalized at our facility for bacterial endocarditis.
Oh my goodness, that's why he missed his appointment last week. I hope he's okay.
He is doing well. We are hoping he will be discharged today. But Dr. Hart mentioned he had a tooth extraction at your office last month. I was wondering if he received prophylactic antibiotics prior to the procedure.
I don't think so. Why?
Well, we believe that the bacteria was introduced into his bloodstream during the procedure and caused the infection. He became quite ill after just 2 weeks and was admitted to the...
Oh, wait a minute. Are you trying to say that I got him sick? I've been practicing for nearly 30 years and no one's ever accused me of harming a patient.
No, Dr. Williams. Mr. Hart has told me what a great dentist you are and the wonderful care that he has in your office. Perhaps the patient did not inform you of his heart condition. Patients aren't often aware of how serious this problem is and may not notify their dentist, which is why I personally wanted to call and make sure you knew that he had a pre-existing condition.
Do you mean Mr. Hart has a pre-existing heart condition?
Yes, Mr. Hart has a history of endocarditis.
What? Endocarditis? He never mentioned it to me. Let me look at his chart. Well, he did report a history of heart murmur, but denied having ever been told by a physician that he needed antibiotics prior to dental treatment. His extraction was carried out according to AHA guidelines.
Many patients don't realize how serious this can be and don't fully inform their dentist about this problem.
Yes, that is true. It is a problem. How do you suggest we make sure Mr. Hart gets the care he needs in the future?
This case is a good example of how better coordination and a conversation between the primary care provider and the dentist could be beneficial to help provide additional information that a patient may forget to share. I know this is challenging in the course of a busy practice for both the primary provider and the dentist. What might work well to facilitate this type of exchange in your practice?
Well, usually I do try to reach out to the primary care provider, but somehow this seems to have fallen through the cracks for Mr. Hart. The biggest challenge is often getting a response from the primary care provider. Now, I'm not sure what happened with Mr. Hart and why he fell through the cracks, but I need to look at the system I set up in my office to see how to avoid this in the future. And I will actually make sure to delve into the history a bit more by asking additional questions in patients with heart murmurs in the future. This is a really good learning experience. Thanks for taking the time to talk about this. I really appreciate it.
Of course, my pleasure. Thank you for your time.